Good morning. This is Tracy Tribeck, and welcome to Your Health Matters. Today, we will be discussing personal preparedness and building community resiliency, both important topics in an emergency and/or a disaster. Today, my guest is Megan McPherson. She has a master's degree in public policy, and she is a certified emergency manager. She also is an assistant director of the Adelphi University Center for Health Innovation, also known as CHI, as well as a program coordinator and adjunct faculty for graduate programs in emergency management. Ms. McPherson has over a decade of experience in emergency management and is credentialed as a certified emergency manager in both public and the private sectors. Welcome to the show, Megan.
Thank you so much for having me. I'm happy to be here.
Yes, it's a pleasure. First, I was wondering if we can discuss with our viewers when hurricane season occurs every year and why it's important that we realize, really why this season and of course other disasters are important for us to know what we can do to help our families and ourselves.
Sure. So I think hurricane season is a great reminder. It's a nice kind of bookended season to make sure that we're prepared. So it runs from June 1st to November 1st is where we see the highest frequency of hurricanes. But it's also a good reminder of how emergency managers now look at everything as all hazards. So you can use the same preparedness that you toolkits and things of that nature that you would use for a hurricane, you could use for winter storms, which we saw a lot of this past year. You can use them for flooding. You can use them for any type of event that would affect your family that you would need to either shelter in place or make sure that they're okay. So it's a nice way to highlight and remind you that, I need to make sure that I'm ready for that.
Okay, that's great. Thank you. So now, knowing this, and the fact that the public should take responsibility, how can you guide them on how they can get a list? Like I was looking this weekend again just to refresh my memory on the computer, and I did some searches. But is there a list that you recommend for people to find and prepare for their families and say if they have pets and children and whatnot?
I think the best list that you can find online is at ready.gov. That is run by FEMA and the Department of Homeland Security. And ready.gov is very user-friendly. It gives you lists not only for the humans in your house, but also the pets. And it also gives you different resources. It has some coloring books you can print out if you live in a very prone area to disaster, to make your children feel less stressed out as events like that happen. And living in the area that we do, we are more prone to see certain events in the New York area than we are in other parts of the country. And when you have that list, you also can build your kit, which we have some examples of here. And it can be overwhelming, but you can also section it out and go from there.
Right. You can continue to add to it. Okay. Now, how does having your own kit help assist first responders?
So if you have your own kit, of which we'll go over in a little bit, if you have your own kit, you should be able to sustain yourself and your family and your pets for 72 hours. So in doing so, in the immediate aftermath of an event, it allows first responders to not have to respond to rescue you and worry about you, and they can handle other situations that are coming up that may be of a larger significance. If a pipe bursts or if a natural gas line goes, a lot of things we saw during Sandy, if something like that happens, or if power lines are down everywhere and they need to remove trees and power lines and there's injuries, they can worry about that and you're safe in your home. We always tell people to be ready for 72 hours on their own. It used to be 24, then it was 48, now we've gone to 72. And it's to be able to sustain your family and your pets for that length of time before anyone will be able to help you. You may be blocked in and sheltering in place, depending on the event.
Okay. So well, maybe this is a good time to bring this one up. The emergency management preparedness mantra remains: build a kit, make a plan,
Yes.
and stay informed.
Yes.
So can you give our viewers some of the best ways to stay informed?
Sure. So the best ways to stay informed would be you can listen to the radio. I think if you don't have television, you're going to listen to the radio. I actually have here my favorite new type of radio. It's a weather radio that NOAA has put out, and you are able to use it as a crank to get power. You can also have a solar panel on top. You're able to get radio. And it has a little antenna. You're able to get radio, so you can get local radio. Also, a lot of our local news stations broadcast over radio in the New York area. That's actually what I was listening to during Hurricane Sandy. And then also, you can charge your cell phones in this as well, which is another way, obviously, to stay informed of what's going on. If you're able to somehow get out onto social media or things of that nature, you can charge so many different types of phones. This one comes with different chargers, and it all charges off solar. And you don't need it to be very sunny outside to charge off solar. You just need to have some kind of sunlight. So the old ones were crank only. Now this has crank and it has solar, and it also has a flashlight associated with it. So it's kind of an all-in-one. I bought them for my entire family. So I find them to be really, really helpful for being informed. And also, I think another one of the things about communication is you should always have the numbers written down, because we all keep them in our phones, but if our phone dies, make sure our numbers are written down of family members, but also have a landline. And this is something this is an old landline phone, just a $9 phone, but and I keep a landline service just for emergencies. You can actually get that from the phone company just for a very low a month. And you can call out, and we recommend that you have numbers of folks who are not in this area. So I have relatives that are in Minnesota. I would we have a plan in my family that we would all call them, because the lines are actually able to handle that volume rather than local volume. So if I call in and my mother calls in, my uncle can tell both of us that we're okay, even though our lines between us weren't necessarily working. So this is something that I think is very important, and I keep in my house.
That's a very good idea. I appreciate you telling us about that one. Because I think many people have, probably this. It's like the cell phone is the phone to have.
It is,
and they think that it's a very good phone, and so then they stopped, buying.
Absolutely. People stopped getting landline, and you don't have to have a full phone service, but you can get an emergency one where you can call 911, which is another reason to have it, because your cell phone may not be able to push off the tower for 911.
And we'll be right back after this message.
Hi, I'm Tim Stead. I'm from Star Communications. We're a marketing support company. And if you need help with your next marketing project, please call 273-1900. Or you can go to our website, starcommunications.us.
And we're back. We're talking today about emergency preparedness. And my guest is Megan McPherson. She's the Assistant Director of the Adelphi University Center for Health Innovation, as well as Program Coordinator and Adjunct Faculty for Graduate Programs in Emergency Management. Thanks again, Megan. So we were looking at this phone just before the break, and we were going to start discussing how to build your own kit.
Yes. I think one of the most important things is that it can be overwhelming. So when people think about a kit, they think about having this very large bag and having it's very expensive. So you don't have to go all out. It depends on what your needs are. So if you have children, if you have your adult parents living with you, you want to make sure you just have the supplies needed for the people in your house. So the old rule is having 1 gallon of water per person per day, and you want to be able to last 72 hours. So that's 3 gallons of water per person per event. It's a good kind of round number. I didn't put water out here because I think there are other things we could talk about that are just as important to have. So one of the biggest things we saw is we actually did at CHI a preparedness poll. And what we found is that 37% of respondents didn't know what medications they took, didn't know why they took them, and when they took them. And that's something we saw especially with the elderly population, of which we have a large amount on Long Island. island, aging in place, that they need to know that, because if they are evacuated or if they go to a shelter, they need to have that information. So one of the biggest things to me for kind of continuity of care in these type of situations is to have all your medications written down and have your doctor's numbers written down and why you go see them and why you take the pills. There's great little magnets you can get that you can put up. I've actually bought them for my parents. You can put them up on the refrigerator. You keep all that information there and you can either grab it and go, or if someone's responding to your house for a medical emergency, they can grab it. So it's also really important to have supplies for your pets. So you want to check those dates to make sure they haven't gone bad as well. And you have food for them, and most places now, most shelters, if you're evacuated, will take pets. It'll say that if you look ahead of time, before, if you know a storm's coming, or it's good to know where the shelter is anyways, you can check that at any time. They'll put your pets in a separate area. They have to be in a carrier, but you can go visit them, and I think it's good for stress levels for both the pet and the human. And you make sure that you have the food for them so that they'll be okay as well, because the stores won't be open for them.
And maybe a toy or two?
Yes, a toy or two, and I just brought some food in a little bowl for my dog Sam, but you bring all sorts of things with you to make sure that they're okay. And that's a great lesson that we learned post other storms, is that people won't leave without their pets. And so it goes back to not being a hazard to the first responders. You're taking care of yourself. Another thing is batteries. When you can't find a battery to save your life during an actual storm run up,
and then they charge.
And then they charge you so much. So when you are looking at the food and you're looking at you're changing the lights and everything, changing the smoke detectors. That's an off season on both sides. So you can go get batteries, and you're not going to be running into everyone else trying to get batteries. So I always restock up to make sure that my batteries are ready when I'm looking at the smoke detectors as well. It's a good reminder.
Yes, it is. That's a very good reminder. Is there, what about carrying important documents in a plastic bag?
So your documents will want to be in a plastic bag as well, as you said. So your medical documents, but also if there are other documents that you think you should have, maybe your passport, your license, your medical card, the deed to the house, all the things that you might put into a fire safe, you want to have in a plastic bag that you can grab it. Even if it's copies, if the originals are at the bank in a safety deposit box, it's good to have copies. And then we're talking about just hygiene and safety. You want to have plastic gloves, some trash bags, something to put over a mask to put over your mouth. You're prepared for anything basically. And then also you want to have a wrench and some needle nose pliers, and maybe a couple other tools that you have an extra set of in case you need to shut off certain valves. If you have water rising, you want to shut off the valves to your house for, say, natural gas. So it's important that you're able to do that. And then Lysol wipes are always our best friend to kind of clean up things. And my favorite thing is, one of my other favorite things is the headlamps, because a lot of times you need both your hands when you're walking around the house and getting things done, and the headlamps you can get that are a flashlight are fabulous.
Okay, that's great. And now, what are the, what will the water, these are the water tablets?
Water tablets, yeah. So they're going to be able to sterilize the water. If the water that's coming through the pipes is not drinkable, you'll be able to use that to sterilize the water.
But you would prefer everybody to have 3 days worth for each
bottled
person,
water. Much prefer that.
Only if they run out.
Yes.
Then that would be an
that's
alternative.
again, but that's preparedness. That's having a
exactly.
backup plan to your backup plan.
Exactly.
Yeah. So there's a lot here, but it's I think it'll help folks.
Is there any other item that I had my list? Sorry about that. But as you said, they can go to ready.gov and it can tell them, like, specifically for people with special needs, for people with babies, the elderly, and just what the main list would be. And as you said, some of these items can be quite expensive, so they can do a little starter kit, and then they can add to it gradually.
Absolutely, absolutely.
Right, but the most important thing is to check the expiration date on items that do
the last thing you want to be is sick in the middle of something that you can't get taken care of. So
that's
absolutely.
Okay, And then it was a very good tip to get a landline just in case the cell service. I think that happened, we had a hurricane like a year ago. There's absolutely no cell service. Had to drive to like a parking lot that was partially flooded.
I know. It's, you know, it's also important when we talk about the three things, you also want to make a plan. And so your children should know if they're at school, what should they do if something happens? If they're told that there's an event or a disaster or there's a flood, they should know what to do. They should know if everyone's home, where do we evacuate to? You know, just like when you have elementary school and everyone runs to the same tree and they meet there, you should have that same type of plan. That's, you know, have a kit, make a plan, stay informed. So it's important to have a plan that if you are in a flood zone, which they've redone the flood zones, if you need to evacuate, it's good to know where you're going to go. Are you going to go to a family member? What roads do you need to take there? But also to have one for just in the house. If there's a fire, where do we all meet? And that's really, really important as well.
That is. And it should be, like every 6 months, or how frequently should the family review that
I would say twice a year. I think that's, you know, it would just be, it's sometimes calling it an emergency plan is a little less scary for younger kids especially, but it is a disaster plan. But if there's some kind of issue where you need to evacuate the house quickly, everybody having a meeting spot is really, really important.
Okay.
Yeah.
That's great. We're going to go to break again, and we'll be back in a moment.
Hey Larry, every week I watch your show.
As you should.
And I know so much about sports now. Thank you.
You should be learning about sports, and everybody should be watching all our other shows here on the Daily Blue.
Why are you promoting the other shows? I thought you were the king of the Daily Blue.
That's true, but I'm all about everybody. It's not always all about me.
No, it really
about
is.
The team.
Every day I wake up and it says, today is all about me, Corinne. Don't
I've
lie.
heard that.
Don't lie. Tune in every week to the Daily Blue and you'll see Sports Biz with LD, and you will get a lot of information, updates in sports, and a little bit about Sports Biz.
And that's me, Larry Davis, Sports Biz with LD.
Today on Your Health Matters, discussing emergency preparedness with my guest, Megan McPherson, the Assistant Director of the Adelphi University Center for Health Innovation, and as well as the Program Coordinator and Adjunct Faculty for Graduate Programs in Emergency Management. And we've been discussing different aspects of emergency management planning, and we're going to building a kit. So the build a kit, make a plan, which we just discussed, and now we're going to move on to the staying informed, but mostly how a community builds resiliency. So if you could kind of walk our way through that, I'd appreciate it.
Love to. So the Center for Health Innovation at Adelphi, we are under the direction of our director we've had about a year now, Dr. Elizabeth Cohen, and our first project that we started to work on was the Initiative for Social and Community Resiliency, because we looked at the needs of the community as well as the strengths at Adelphi and how we could put those together to really make a difference for the local community. So social and community resiliency is a way to do so. We talked about personal preparedness, and then at a much higher level, you have you're building resiliency at what we call the built environments. You're making sure the sewage plant works, the power plant works, all that, the built structures are ready to go. In the middle there is something that isn't addressed very often, which is building that community resiliency so that folks can rely on that as well. One of the best examples is saying when you get to the scene of a disaster or an event, you're not exchanging cards at the scene. You already know each other. And by building those networks, you're able to move through a disaster much more smoothly. So you know you're going to be facing a lot of things when this type of thing happens. But when you're not exchanging cards and you know that Bob's coming and he's going to bring this backhoe, and we know there's a lot of things that can move faster. So through this resiliency initiative, we had 2 grants. We worked with 2 towns, one in Suffolk, town in Nassau, and a village in Suffolk. And we worked with them to build resiliency. So we did a gap analysis with them of looking at where they thought that they needed the most help and where they could build more systems in. So it's really about building in the systems. So to have folks in the community know where they should go for certain certain documents, rather than just calling town hall and everyone being confused.
Could you please explain to our viewers what a gap analysis
Sure,
is?
I apologize.
No, it's okay.
So they would, you look at all of the items that could affect you during a storm or an event. So you look at what would you do you have a fire department? Do you have an EMS department, emergency medical services? If you don't, how far are they? Do you have a hospital? Do you have certain things in your town that may be more targets for man-made items? Do you have an emergency operations center? Do you have, and a lot of it is protocols, do you have protocols in place that your records are kept off-site? So if your records go down, well, most things are on the computer now, if your records go down locally, are you able to access them off-site and not lose them? How can you expedite different things after a storm? So if buildings need to be inspected for FEMA to put together the package of aid, do you have enough people? And if you don't, what system can you build to do so? What systems can you build in to inform the public better? So you look at what you have and what you don't have, and thus you have your gaps. And then we worked with them to build in some community infrastructure, community folks into that to address those issues.
Okay.
So you have to know where you are
Right.
to know where you need to be, because every town is different. If you know one community, you know one community, my director always says. So, it's important to try to figure that out.
Okay. So are you basing your assessment on one specific set of criteria, or do you modify that because of demographics and?
Well, what you would do is you actually modify the approach to solving it by demographics. So you would look to see, a lot of it is, what are the main languages spoken in your community? Do you have outreach in those languages? If you don't, when you're telling them about preparedness, you need to build in some systems so that you are speaking to them in a language that's native. And also, you're building the connections with folks that they trust. So you're building connections with the churches and the synagogues where people feel like they can trust their leaders, and then their leaders can help send out the information. It's not just coming from government. You're building, it's kind of this bridging and bonding of social resiliency that they talk about. Once you have that bonding among people where you have a real community, you're able to come back a lot faster than everyone just on their own.
Exactly. Yeah, and when within the community, and as you were saying, when you know who to expect because you're doing training and you're getting to know everybody, it does improve the outcomes.
Yes.
When there actually is a disaster or an event that occurs, and because when you train and you get to know all the people and the community members that are involved, then you actually will have that better outcome, just because you'll know who's going to be where
Exactly.
and when.
Exactly.
So I think that's great. Is there anything else about this initiative that you'd like to tell us about?
Well, I think we've done our first two jurisdictions, and we'll be hopefully putting out another call for applications in January of 2016. And we're still working with them to build in more resiliency. More information can actually be found at our website, is chi.adelphi.edu. We have something called the Think About It blog, where we're always updating new information about our work, and you can also find that on our Center for Health Innovation site. Again, it's chi.adelphi.edu, and you can keep up with all our different initiatives. And we'll have two more coming out over the next couple of years, looking at raising the healthiest class of 2035, so babies born in 2017, and then also aging in place, as we have the boomers aging on Long Island, and making sure that we have systems in place to help them as well.
Yeah,
That's what we'll be working on moving forward, as well as this.
Okay. All right, that's great. Do you have any final thoughts?
Any final thoughts? I think it's just important that, it isn't something to be scared of. I think it can be really overwhelming when you're looking at what FEMA wants you to have. but just take it step by step. What do I need to be clean? What do I need to communicate? What do I need to eat? What do I need to have power? And just take it little by little, and I think it's less overwhelming, but you will be better for it in the end. And when someone says to evacuate, you should evacuate, and pay attention to all of those things that come from the government during an event.
And it's also, I guess, in my thoughts, it's also important to look out for, some companies that want to sell these pre-packed kits for, a phenomenal amount of money, and then you get the kit and you find out that, it's like this big fat package, but only 2 or 3 things are inside of it. So that's just a word of, I guess,
of caution. In my humble opinion, it is less expensive, and you can tailor it to your own needs rather than buying the pre-pack. Post Katrina, we saw a lot of those companies pop up, and it's really, which I understand, it's a need, but you're not getting the amount of things you would really need. And so I think it's better to build your own pack so you know you're covering your own needs.
Right. And I would like to thank Robert Kronk for his contribution to today's show with his backpack. He was an Eagle Scout, and so he's very well prepared for anything that comes.
Absolutely.
Yeah, it's quite heavy. And yeah, he has a lot of supplies in there, and I appreciate all of the supplies that you brought to the show today. And so I thank you so much
Thank you
for
so
coming
much
today.
for having me.
You really were brought a lot of information to our viewers, and it's, I hope that everyone can build some kind of pack and get started and add to it and check the expiration dates.
Absolutely, those are very important.
And this has been Your Health Matters with my guest, Megan McPherson from Alumni University and from Center for Health Innovation. And want to say the website one more time?
Sure, it's chi.adelphi.edu, and go there and there's lots of information.
I thank you for watching, and have a great day.